Thank you all for joining us this afternoon. My name is Marco Giordano. I am your CEO. I'd like to start us off this afternoon by first introducing everyone that's connected to the call to our VP of Business Development, Karin Amahed Harris, who started with us today. Welcome to RHD, Karin. During the past few weeks, we have not shared much detail on the number of cases of COVID that we are experiencing at RHD. As we begin to think about reopening, I thought it was important for us to begin to share this data. As of last Thursday, April 23rd, we have experienced 312 cases of COVID-19 in the RHD community. And sadly, this includes 3 deaths of program participants in Pennsylvania, Boston, and Delaware. We have seen cases across states, across service lines, and across various types of services. We are experiencing currently about 60 new cases a week, with most cases being in our residential settings. However, we are still seeing cases in our community and mobile settings. We've begun to see cases at our homeless shelters, and loved ones of those within our community have also been impacted. My thoughts and prayers go out to all those impacted by COVID-19 in the RHD community. With that, we must all do our part to stop the spread and minimize the number of cases of COVID-19 within our community. Over the past 7 weeks or so, we've shared various protocols and guidelines to mitigate the spread. I have selected 10 guidelines that I want to emphasize with you all today. Number 1, wash your hands. We all know the happy birthday song. Sing it twice for 20 seconds. Number 2, practice social distancing. Stay 6 feet apart from each other, shelter in place or stay home. Number 3, clean surfaces and high-touch areas frequently. Use cleaning supplies or soap and water. Number 4, wear a face mask or a face covering, whichever is appropriate, but one is required. Number 5, wear other PPE as required. Number 6, monitor your symptoms, including your temperature. Number 7, no visitors. Minimize essential time spent face-to-face with other people. Number 8, follow quarantine and isolation protocols where applicable. Number 9, stay home if you're experiencing symptoms of COVID-19 or any other symptoms of any other illness. And number 10, which I feel is the most important takeaway, is support the individuals we serve in complying with these important guidelines. Now more than ever, the folks we support or the folks that we serve need our support. Following these safety guidelines protects the health and well-being of everyone in our community. The country is starting to see confirmed cases level out, while hospitalizations and deaths are starting to decline. As state and local government begin to think about reopening, a steady decline in cases will be necessary. We have begun to explore what reopening will look like at RHD. We will need to answer questions like, how will we reopen our day programs while embracing social distancing? How do we promote social distancing in our open administrative environments? What amount of PPE will be required in order for us to reopen RHD? And what protocols will be required to support the people we serve while out in the community? These are examples of the many variables that we need to consider. Over the next couple of weeks, we will continue to explore what reopening looks like at RHD. And we will provide guidelines that will follow the state and local government requirements and the requirements of our funders. Finally, I want to express my gratitude to all of our staff who've been working our front line and behind the scenes, continuing to support the people we serve. Today, I want to give a special shout out to all of our administrative staff who continue to ensure the availability of our administrative functions and support. The collaboration and support we are providing to each other has been incredible to see and experience. I thank everyone who is working today and working to make sure that we are supporting the folks we serve every day. The work we're doing together is truly an example of together we're better. Today on the call, we're going to be providing a variety of updates relating to our COVID-19 response. Please send your questions through chat. We will be addressing questions at the end of our time today. Now I would like to pass the mic to Sean Mott, who was facilitating our meeting today. Thank you.
Thank you, Marco. And as Marco stated, I will facilitate the call today. And just as a few friendly reminders, to best manage this call for so many employees that are participating today, all lines are muted. In addition to that, the only faces that you will see at this time are that of the panelists who are scheduled to present. As Marco stated, you have a variety of ways in which to present questions. One is through the chat feature, and we're collecting questions throughout this call. Perhaps you will use your voice or the RHD_COVID_19@rhd.org is another way in which you can share questions. All questions will be organized and then presented to the appropriate presenter for responses. With that said, I will now pass the presentation to your first presenter, who is Baroness Martin. Baroness?
Good afternoon, everybody. My name is Baroness Martin. I am the Vice President of Culture, Diversity, and Inclusion. I want to start off just by thanking everyone for all the hard work that's being done during this COVID-19 crisis. Certainly it is appreciated from every level of the organization, and we really appreciate, again, all the work that's being done. This week, I wanted to do a highlight and a shout out to Mainstay Philadelphia's team. Mainstay Philadelphia is a supervised community-based residential program designed to provide a range of established and innovative rehabilitation strategies for adults with developmental disabilities. In response to all the changes brought on by COVID-19, RHD Mainstay Philadelphia has made notable programmatic efforts to continue providing quality services. They've moved forward in partnering with Vibe, which is a medical provider that will conduct staff physicals and TB tests for all their new hires. They're working on contracting with Cisco to provide the program with food and paper products that will be delivered by truck to their offices and distributed to the residential homes. This will limit the supervisors having to do as much shopping and to limit their risk to exposure. They are distributing PPE each week to the sites in order to keep them safe. And they are also doing little things, which I call small acts of kindness and care, to show appreciation to their staff. For example, last week, they handed out handwritten thank you notes to every staff member, along with a little bag of candy. This week, they're giving out extra gum, a package of extra gum, with a note that says, "You are extra special to us. Thank you for all you do." I encourage all of our programs to participate in small acts of kindness and in care and appreciation. It truly does go a long way. Kudos to Mainstay Philadelphia's team for the effort, creativity, and for providing to keep their team safe. Thank you, Mainstay Philadelphia. An update, give them a hand, round of applause, round and around, yeah, keep going. There's a couple of you that can't see your hands. Thank you, Deanna, you know what you're doing, girl, you're rocking it, thank you. Next, I'd like to give you an update from the employee support domain. I'm gonna just talk about one of the initiatives today, but there are several. These COVID-19 Employee Relief Fund was established to provide funds to employees that have been furloughed, if programs closed, or to those who have lost hours due to the being affected by COVID-19. Last week, we mailed out 540 letters. The COVID-19 Relief Fund Committee realized that many of the RHD staff that had been furloughed may have not been checking their RHD email and not aware of the relief funds. In an effort to inform staff of this fund, these letters were mailed out to all furloughed staff. Although done with the best of intentions, there was an error made. The program summary status list that was used to provide the mailing identified some offices as closed. However, some staff were working in programs and providing modified community or remote supports. As a result, many staff that were not furloughed got these letters. Again, we do apologize for this error. This was again done with the best intentions. We have addressed and corrected this situation. If you have any questions, please reach out to your immediate supervisor. Good news, to date, we have received over 40 applications. We started the fund with $50,000, and because of employee donations, we now have an additional $10,000 in the employee relief fund. We want to encourage those that have, thank you all that have contributed. Again, we want to encourage those that wish to make a donation, please do so. The instructions are on the COVID website committee page, also on MyRHD, as well as other initiatives that are being done by the Employee Support Domain. I want to thank again everyone. We just look forward to providing as many resources as we can, because we are resources for human development. Doesn't mean just for the individuals we serve, but it means that for each other as well. Thank you. I'm now passing the baton over to Christy Katz-Friedman.
Thank you, Baroness. I just want to start off and say, so I'm Christy, and I want to start off in saying, I think one of the things I enjoy most about this is watching the participant number at the bottom of the screen go up as the meeting goes on. And I'm so happy and thankful that so many people join each week. And what I would want to ask is, if you know somebody is not on the call because they weren't able to connect, and you hear something that you think that they should hear, please share it with them, because some of us don't have the same opportunity to get on during this hour, but the information is really helpful. So I just want to remind everybody of a couple things going on, and say again, another thank you to people who are reaching out, asking for helping hands, or just want to talk. It's great. Sessions are being given across the country through Zoom, Skype, however you need them, they're happening. Another great thing that's going on is we've been talking about Cornerstone and the extra trainings that they gave us for free. Cornerstone has extended their training, so they're not going to go away April 30th. We now have them until May 15th. So please take a look, take advantage. They go anywhere from 2 minutes to 2 hours, but a 2-minute mindfulness practice may be just what you need for your self-care every morning, afternoon, or evening. And then lastly, I wanted to tell everybody, if you haven't heard this yet, our dietitians that we work with are doing Zoom sessions in your own home. So you can open up your cabinets, show them what you have, and say, what on earth can I make or cobble together from what I've got going? Because I don't know, I shared with some people last week, I ate party mix for breakfast, and that was not my best decision. It's what I needed to do for my self-care in the moment, but I am somewhat regretful later in the day. So take advantage of the sessions, they're really good, and now you don't have to go anywhere for them. They will join you in your own kitchen with recipes and other suggestions. So the things that I'm sharing with you come from your requests. They came from what you felt that you needed to help with your self-care. If there's something that you're not hearing, seeing, or experiencing, and you think you would benefit from it, reach out. My email is Christy. You see it on the screen. It's just Christy@RHD. And I'm here, and we will try to make it happen, whatever it takes. But remember, you must take care of yourself first. Bye, everybody.
Okay, hi everyone. I'm Linda Donovan. I'm the Chief Program Officer for Behavioral Health and Housing. And I wanted to share two quick points around hazard pay today. The first is when we established hazard pay, it was effective through the end of April. So much was changing so quickly, we wanted to get it up and going and then give ourselves a chance to look at what are the needs that are presenting. So just wanted to let everyone know hazard pay has been extended through the end of May 31st. And as it gets closer, we will be reevaluating with the input of you around what is needed for hazard pay. The second team, I just wanted to, second point to share is that if you have questions around when is hazard pay eligible and not eligible, just raise it. Let's talk with unit directors, financial managers, service line directors, myself, because there's a lot of situations where it's not easy right away to determine what that is. So just wanted to offer that up there. If there's questions, reach out and we will work through it together. So that's it for today. I wanted then to share over with June, who will be talking about changes to our protocol document. Thank you.
Thank you. Hi, I'm June Hodges, Director of Risk Management. Today, I'm going to briefly mention a few best practices that some of our shelters have adopted and that we also recommend for larger congregate sites. These practices, of course, are in addition to the COVID-19 basic protocols previously distributed that relate to personal hygiene, social distancing, visitors, temperature taking, and following stay-at-home orders. So some of the best practices that we feel are really important, try to reduce activities that congregate many residents and or staff at once, such as meetings, house meetings, and activities where physical distancing of at least 6 feet can be maintained. So also we want to institute curfews to keep residents at the facility as much as possible. And some of those can also arrange a stagger schedule for meal times so residents are not all together at one time, or when possible, distribute individually packaged meals. Review sleeping arrangements to keep 6-foot distance or institute head to toe as allowed with facility spacing. And if you need to transport someone, limit the number of people in the vehicle. Wear face masks, put the windows down to keep the air circulating. Again, our goal is to reduce the spread of illness, so it may be necessary to limit movement in and out of the facility. For residents with COVID-19, seek hospitalization or government-provided COVID sites. I think there's one in Center City at the Holiday Inn Express. So we can adhere to isolation protocols if the facility cannot accommodate. Consider providing increased entertainment options that avoid close contact, including television, puzzles, magazines, coloring books, solitary games, cards. Encourage residents to stay in place and, of course, more than 6 feet apart. Discourage public transportation use. If residents have individual rooms, recommend they stay in the rooms as much as possible. If residents need to be in the public or shared spaces, require them to wear disposable or cloth face coverings if appropriate. Obviously, anybody who has trouble breathing or has asthmatic conditions, something like that, we would want to be considerate of, and maybe they could stay in their own space. So thank you. Those are just a few of the best practices that you'll find in our updated new COVID-19 protocols that will be distributed this week. And now Bernie Glavin will discuss temperature taking protocols. Thanks.
Thank you, June. I'm Bernie Glavin. I'm Executive Vice President for the IDD division. And as June referenced, I'm going to talk a little bit about temperature and symptoms checking. As the pandemic has evolved, we've tried to watch the CDC guidelines, different state, municipal, county guidelines, the World Health Organization. So we're trying to stay abreast of all the changes and doing what we can to make recommendations to keep people as safe as we possibly can in these difficult times. So the temperature and symptoms checking that I'm going to talk about, the goal is to try to decrease the spread of the pandemic. So we're going to ask folks to do a couple things, but I want to be clear up front. The steps that I'm going to go through, they're for folks that are going to work in our programs, that are going as essential staff into the offices, that are interacting with other staff. If you're a staff person that's working remotely and you're not having contact with other staff, we're not asking you to follow these guidelines, okay? Just so we're clear up front. What we're asking staff to do is, whenever possible, we're asking employees, before they leave their home, about an hour before your shift, to use a thermometer if you have one at home, to take your temperature and to log it in a sheet that will be posted in the protocol packet that June was just talking about. If you don't have a thermometer at home, then when you go to your work site, we're asking you to immediately ask your supervisor to use a thermometer there, to go ahead and take your temperature, and again, to list it on the log sheet. We're asking folks to also, about an hour before your shift, to go ahead and check the symptoms that you have. The symptoms and the temperature are all listed on a sheet that we're asking folks to fill out on a daily basis, and then to turn into your supervisor at the end of the week. As I mentioned when I started, it's an ever-evolving process. The policy or the protocol and the check sheet was sent out on Friday, and then true to form over the weekend, the CDC added 5 more symptoms. So we'll be revising the form that we just sent out on Friday. But the symptoms that we're asking folks to look at is a fever greater than 100.3 degrees, unless your local state or municipality has a different guideline for that. A cough, shortness of breath, chills. They were the original 4 symptoms. Over this weekend, also added was muscle pain, headache, new loss of taste or smell. Not if you've had that as a standing condition, but a new loss of taste or smell, sore throat, and repeated shaking with chills. So all that will be included on the revised check sheet that we send out. Again, the protocol and the sheet went out on Friday. There was a change over the weekend. The protocol will remain the same, but we will be updating the check sheet. Okay, so just to recap, it's an hour before, take your temperature from home. If you don't have a thermometer, take it as soon as you get to the site. If your site does not have a thermometer, then just skip that part, but go ahead and still go through the symptoms and fill out the check sheet for the symptoms. We did get a large order of thermometers in last week, and just so everyone's clear, the thermometers that we've been able to get in are not the infrared thermometers, they're the individual thermometers. We've ordered infrared, we've ordered individuals, we're ordering everything we can, but like we said in other calls, so is everybody else in the world. So go ahead, take it at home. If you can't take it at home, take it when you get to work. If during your shift you start feeling ill, please, again, go ahead and take your temperature, speak with your immediate supervisor. The guide is really to try to, if you're not well, you should not be at work. If you're not well, you should be reaching out to your private healthcare provider and getting guidance on testing or whatever else they think that you should do. We're again reinforcing that we're asking folks to use the PPE forms. We're asking you send 1 form per program. And again, as it stands right now, when you send it in, and when you're requesting thermometers, know that you're requesting not the infrared. When we get those in, we will let you know, but know that you'll be requesting an individual thermometer. So where programs requesting 2 or 3 infrareds, that's going to change to maybe 20 or 25 individual thermometers. Looking over, I think that was pretty much it. And again, all this went out on Friday. The revised list will go out, and once we do the updated protocol, to be included in that. Thank you. I'm going to turn it over now to Rebecca.
Thanks, Bernie. Hi, my name is Rebecca Bixby. I am the executive clinician for FPCN and director of primary care. I'm back to talk about my favorite thing, personal protective equipment, PPE. And today we're just doing a little bit more information on gloves. So a couple things about wearing gloves. The intent of wearing gloves is to protect against exposure to blood, body fluids, secretions, or when you're going to be into in contact with mucous membranes. They are not recommended for general use if you're walking around a facility or even going out to shop necessarily, because anything your hands touch, and then if you touch your face, it's the same if you wear gloves and are touching multiple infected surfaces and then touch your face with gloves. So really what we want to use gloves for are limited patient or interpersonal interactions where you may be at risk of exposure to blood, body fluids, mucous membranes. Now, we are recommending gloves more frequently these days, of course, because of the coronavirus and the potential for infection. So interacting with people who formerly you may not have needed to wear gloves with, it may now be recommended by your facility to use gloves during those interactions to prevent transmission of infection. So the types of gloves that we're talking about, I have nitrile gloves. These are very strong and they protect very well against chemical exposures as well as viral and bacterial. They are a little bit more expensive than vinyl gloves. Vinyl are also entirely appropriate. Gloves that are not as appropriate are latex containing gloves, of course, due to the fact that many people have allergies. And also the FDA has now stated that we should not be using powdered gloves. They should not be around, but in case you do have powdered gloves at your facility, they should be replaced with either the vinyl or nitrile. Fit for gloves, they do come in multiple sizes in some cases. Others are one size fits all. If that's what you have, that's fine. If you can get fitted gloves, you measure simply at the widest part of your hand, and mine is about a small. So they do come in some brands in small, medium, and large. If they're too large, the only issue is you lose some dexterity, and it might lead to fumbling or dropping, and of course that can lead to spillage or some other potentially infectious exposure, as well as if there's a gap at the bottom because they're too large, you really want to make sure that you rubber band that or something, because anything could get in that gap. And if they're too small, the main issue is that you'll break right through them when you try to put them on. So when I'm putting these on, I already have a gown with a finger loop. So you want to make sure if your gown has finger loops that you already have your thumb inserted through the loop. If your gown has a cuff, then the glove has to go all the way over the cuff. Again, that's to get an appropriate seal. So when we're putting them on, just goes right over the gown, and you can tell these are tight enough to have a pretty good seal there. Put my other one on. That's it. And then you go and you perform what you need to do. I think we mentioned last time, and I'll just reinforce, before you do this, you always want to sanitize your hands. And if while you're performing care with the gloves on, you spill something onto your gloves, but you don't have another pair, or you don't want to change because exposing your skin could again potentially expose you, you may perform hygiene with the gloves on. And it's the same thing as if you had just your skin. You make sure to cover all surfaces and then get in between the fingers while wearing your gloves. Air them out a little bit and then you keep going. So to take these off, there's actually two methods. One is called a beak method and one is called a glove in glove. So I'll do the beak method first. Beak method is you pull one glove so that it's inside out over your fingertips and thumb. You then grab the other glove, pinch it at the wrist, pull it all the way off and dispose of it. And with your bare hand, you then simply remove, now you're touching just the inside of this soiled glove, and you remove it and discard it. Put on my next pair. The other method is a glove in glove. I find this to be a little bit easier. So you just pinch at the bottom of the one, pull it all the way off, ball it up in a fist, and then I'm reaching underneath to the clean side of this glove, and with one finger just taking it all the way off and discarding of it. And then of course, when you're done, you would perform hand hygiene again. So I think that's it for the demonstration today. Thank you so much.
Thank you, Rebecca, and thank you to all of our presenters. We're now at the time with our call for the open Q&A. Throughout this process, I've been fielding questions through my support through Tara as well as Sarah, and I have questions to pose to our presenters. If the question posed to the presenter is not within your field or within your purview, I would just ask that one of the other callers would chime in. The first question we believe would be to Marco, and it's regarding the dynamic of the state stating that we can open back up. So if our state starts opening up, will the ADT be able to open?
Thanks, Sean. And for those that may not know what ADT stands for, it's Adult Day Training Programs. That's a great question, and I appreciate the participant who asked it. And when we begin to explore opening RHD, we will want to understand what our states are asking us to do. And most states are going to follow the spirit of the federal guidelines. We will understand what our funders will want us to do. And then we will also layer into that as RHD, what safety protocols are we going to implement as well? We will have to align those three together and make sure that as we reopen RHD, we're doing it in the safest way possible for the benefits of the folks we support and of our staff as we now begin to operate differently in a reopened environment.
Thank you, Marco. The next question is actually a possible suggestion. And because it's a fairly lengthy question, I'm going to paraphrase. And this question is for Brandon and possibly Linda. This particular caller has identified that there are examples whereby individuals who test positive for COVID-19 are all sort of sitting or staying within a designated location. So this caller would like to know if RHD is considering or would consider creating an environment for all positive tested individuals to stay within that environment. And then that environment would be staffed by employees who would be willing to work within that population with that designated area. I trust that the way in which I paraphrased that question was helpful. Linda and Brandon, if more clarity is needed, please advise and I will revisit setting that up. But Linda and Brandon, thoughts about that proposal and that idea?
Yeah, number one, thank you for the idea. I think it's important that we are sharing ideas and different ways of approaching the problems together. So I want to say that number one. We do work through a lot of different scenarios, and we are taking those on a case-by-case basis. So, while, again, we may look to a scenario where we have a congregate living or a shelter scenario where there are a lot of folks that are in one location, we are looking at possibilities of, wings or other designated areas to be able to shelter large groups of people. When it comes to congregate care or smaller group homes or shared living, those kind of scenarios, obviously that changes things quite a bit. Our goal number one is to protect both the consumers as well as our staff. So if we have a scenario where we can limit the exposure and limit the issues that we have as far as numbers of contacts, that is our number one approach. So while again, appreciate the idea, I know that is on the table as one of the options. We are looking at scenarios which reduce as much as possible the amount of exposure. So I don't know if Linda or June has any to add to that, but I appreciate your comment.
The one thing that I would add is I appreciate it being raised as an option, as an idea. And part of that is really around the geography. where we have a group of people testing positive. And then layering on top of that, their behavioral health or just their needs. So sometimes that could work and sometimes that may not work together. But I would say raise it up to your service line director, your unit director, to myself and Brandon, to Sandy and Bernie, and let's consider it.
And we've certainly seen that in some of the examples that we've discussed with certain programs where we've had people of the same status together in quarantine. Most of the time when someone does have an active case of COVID, they go to a hospital, or in the case of our shelter system, they can utilize the governmental sites already set up.
Thank you, Brandon, June, and Linda. The next question is regarding PPE, and this question is possibly for June or Stephanie. It's a series of questions, and I will break it out into increments. The first part of the question is, why has it taken so long for RHD to mandate wearing masks inside the home?
I'll take that first one. We are specifically following the guidelines and mandates of CDC. So to the extent that it feels like we're not kind of ahead of it, we are making sure that we are following all of the recommendations and regulations as soon as they come out. An example of that is just, for example, in this meeting, Bernie shared that on Friday, we had documentation that was correct on Friday, but which today is not correct. So our timing is based on the most up-to-date science that we can get our hands on.
Thank you, Stephanie. Another part of that question looks at the dynamic when a staff person is wearing a mask, and if they're also wearing glasses, there's a potential for the glasses to fog up. Any thoughts or strategies on how to minimize that fogging that occurs so that an accident doesn't ensue?
I'm going to volley that to Rebecca or to Emily.
Sure. So if you have glasses, your eyes are already somewhat protected. There are some types of PPE that you specifically can wear with glasses. You could also use a face shield like this, which I think is really good because unlike goggles, there's not a whole seal, but it still gives you splash protection. So it is a trade-off in terms of having, if you are performing a procedure where you really need goggles and that wraparound, then this won't do it for you. But my advice would be if it's a procedure where you're not doing any aerosolized procedures producing particles that are aerosolized in the air, this is fine for you to use if you have it or something else available to you that's more like a face shield.
Rebecca, just to follow up on the question there, is there a way to put the glasses on such that, or should we have them on in a certain order to avoid the glass part getting fogged up as we breathe in and out with the mask on?
It's really not, no, just the simple act of breathing in and out and having that air escaping at the top of the mask is going to pass under the lens and cause some fogging. It's important to try not to touch your face as much as possible. So one thing I do recommend that healthcare providers use as well is tying their glasses in the back or getting one of those from the drugstore that's gonna help keep your glasses on because you don't wanna constantly be feeling like you have to push them back up on your face.
Thanks.
Some of the masks have a little feature right at the top where it's almost like a little pad. And so that kind of prevents the air from going and fogging the glasses. We can look for those.
We did just have a recommendation as well that they do sell anti-fogger or defogger. A lot of sports have that for goggles. And I know diving, I'm a scuba diver, we do as well. So, you know, some of that, again, may not be as easy to get a hold of. It's not just running down to Walmart or wherever to get it. But if you have glass defogger, that also does help. My mom actually and I talked, she's a cosmetologist. She had the same problem. And we were talking about getting a mask that fits around your nose tightly so the air doesn't escape. But I actually recommended to her to use some of that defogger that she had back at the house. So you might try that as well, just as another option.
Some sites are also recommending that if you clean your glasses, because I wear glasses, if you clean them with a small amount of soap and water and let them air dry, the soap will create a little barrier on your glasses to keep it from fogging.
And we're also getting some recommendations through the chat that shaving cream does the same trick. So, you know, I'm not sure what will work, but you could try those ideas.
Thank you all for the contributions as to recommendations to tackle that very existing problem. There's one other part of this question, and it's acknowledging that there's a form for staff regarding taking temperatures. Is there a form or process for taking the temperatures of consumers?
I think that the form that we're using for the staff, we could use for the consumers. Again, I want to go back to a little bit of Linda's point earlier. You know, if we want to explain to the consumers why we're doing it, given their behavioral health challenges or cognitive challenges. But the form, you know, it's just a chart form. So if we want to take temperatures, we could use that same form.
And actually, we should be taking temperatures as well. Those who are able to, or who will allow it to happen, it should be taken as well on a regular basis.
Thank you, Sandy, and thank you, Bernie. This additional question is about thermometers as well. Can you speak to the use of thermometers in mobile programs where staff will not be going to an office, but to a consumer's home? What if these staff do not have a thermometer at their home?
So if the staff don't have the thermometer at their home, I would ask them to go through their supervisor to use the PPE request form, and we can send thermometers to the office and make arrangements with the supervisor for the staff to pick several up. Again, if we're able to get the infrared, you wouldn't have to have as many, but until they're available, and they're very hard to come by right now, use the PPE form. We can get it to the office and then make arrangements with staff, mobile staff, and their supervisors so they can pick them up. It's an excellent question.
And the thermometers are individual. So once you get the thermometer, it will belong to you. Once the temperature is taken for one of the consumers, it belongs to them. So all the thermometers that we have right at the moment are all individual for
Correct. They are
folks
not
to keep.
They're not transferable.
Right.
A small thing, but we're encouraging everyone, when you get the thermometer and you place it however you're going to store it in the case, to write your name on that in a permanent marker, so that you know that that's yours and you return it directly there each time, to avoid mixing them up.
Thank you for the responses regarding the thermometer protocol for mobile homes. An additional question has come in, and this is regarding sick time, and this is for Alicia. Why isn't RHD utilizing the Families First Coronavirus Response Act? Why are we having to use our accumulated sick time? Alicia?
Thanks, Sean. So I'm not sure if the question is coming from someone who hasn't been on any of the previous meetings, but I just want to make sure we clarify again. And I believe, sent some communication out, but the Families First Coronavirus Relief Act applied to organization of 500 employees or less, businesses with 500 employees or less. RHD has about 5,000 to 5,500 employees across 14 states and over 150 programs approximately. And I know that what happens is probably staff who are in one particular program may not realize the breadth and scope of RHD, but just want to remind everyone that as a result of that, that act does not apply to RHD employees, as well as some of the relief that is being provided as a result of that act. We are still looking at other, of course, we're always looking at other ways that we might be able to fund additional supports, and some of the employee supports that Baroness has spoken about have been our effort to respond to that, as well as advancing that sick time even before that act was finally passed and signed into law. So that advancing the sick time that people would accrue through December was the way to begin to provide some of that same support, even though that act does not apply to RHD. I hope that answers the question.
Yes, thank you, Alicia. So it appears that we have exhausted all of the questions that have come in through the chat feature. We are also at 1:18. Doesn't mean that we need to go all the way up to 2. However, just wanted to check to see if there are any other questions, or if any of the panelists wanted to expound on any of the answers or questions that have been presented thus far.
The one thing I'd like to share, Sean, is that for all those that are connected today, as we, as an organization, start to think about what does opening RHD look like, I'm certain that there are ideas and questions and thoughts out in the community that it would be important for us to hear your thinking, hear your concerns, hear your ideas, so that way as we together determine what it will look like for RHD, that we are considering and incorporating as much of the community's thinking into the process as possible. We will have process to make sure that we do that in a more formal way, but your ideas and thinking ahead of time will allow us to get to that endpoint sooner than process will allow us over a period of time. So I encourage folks to send your thoughts to us via the RHD COVID-19 email address that Sean probably can share better than I. And your voice is also another option, or any other path you see to communicate directly with this group.
Thank you, Marco. And just to follow up, Marco, it's the RHD_COVID_19 at RHD.org. It appears that we did not receive any additional questions, so I'm going to pass it back to Marco to wrap it up for us today. Marco?
Yeah, before we wrap it up,
Yes.
I'm going to throw something into the mix, and I apologize, Emily, if I throw you off guard here, but I think from your lens, it might be helpful for those connected, particularly those in Philadelphia, to hear about our FPCN locations and sites beginning to do testing, and how that may be beneficial to our Philadelphia programs.
Sure, happy to. Yep, so all of the FPCN sites are doing COVID testing. All you need to do is just call the main number for each site, and we will get you on the schedule. We also have larger testing events happening at our Health Annex site, which is in Southwest Philly, as well as our 11th Street site in North Philly. 11th Street will be on Tuesdays, and Health Annex will be on Wednesdays, where we are doing walk-up as well as drive-through testing at both of those sites. So give us a call and we're happy to schedule you and get you in. We're seeing results pretty quickly, between 24 and 48 hours after we test you. And there's no cost. You don't have to be one of our patients. We will need to put you in our EHR just so the results flow through and we can be able to give them to you. But don't worry about the cost or insured or uninsured or who your primary care is. We can test anybody.
Thank you, Emily. So with that, I will wrap us up and give back all of us, not only those on the panel, but also everybody that is connected with us, back some of your time today. I do appreciate everybody joining us. We had over 300 people join us today, which is great. And I encourage you to continue to join us, as well as share with your coworkers the information that you have learned today. So that way, again, together we can continue to respond to the COVID crisis that we are working through. So again, thank you to the panelists. Thank you for all the questions that were asked. I do want to close this today with a reminder of how we as RHD can, again, mitigate the spread of COVID-19 within our community. So I ask those on the panel to join me, those that plan to join me in sharing, again, re-emphasizing with the community the 10 things that we are asking folks to continue to do and remind folks. So number 1 was wash your hands. We all know the happy birthday song, so sing it twice and wash your hands for 20 seconds.
Everyone, practice social distancing. Stay 6 feet apart from each other, shelter in place, and stay at home. Alicia?
Thank you. I was trying to get myself off of mute. It's not always so easy. Yes, we want to make sure that you are using soap and water and cleaning your surfaces, cleaning your desks, cleaning your work areas, making sure that you're wiping your counters. Keep your area around you clean. And good old-fashioned soap and water helps out if you don't have a bleach or disinfectants or anything like that. So make sure that you are keeping the areas around you clean and prepped at all times.
Wear a face mask or face covering.
Other PPE to consider when delivering services to participants with active infection or while working in sites with quarantine or isolation designations are gowns, gloves, face shields. Bernie?
Monitor your symptoms, including temperature, cough, shortness of breath, chills, and the new symptoms, muscle pain, headache, new loss of taste or smell, sore throat, repeated shaking with chills. Edwin?
Thanks, Bernie. Please, no visitors. If someone does have to visit for an essential reason, we should minimize that essential time spent in close proximity with others, and please continue to follow all other safety protocols out there. Deanna will tell you about another one.
Follow quarantine and isolation protocols, please.
Stay home if you're experiencing symptoms of COVID-19.
And finally, support the individuals we serve in complying with these important guidelines. And you can do this by modeling compliance with the PPE and the other measures, normalize and validate participants' frustrations, and also encourage them that this is for their safety and the safety of everybody else.
Thank you, everyone. Stay well.